Good morning, doctor. I am so glad that airway issues, sleep apnea in children has become so popular. However, I do want to make something really simple for you. I want to break it down to something very, very, very simple. There is something you can do for the child who has any issues with airway, sleep apnea kinds of things. You can expand. If it's primary dentition, you can expand with a quad helix. If it's mixed dentition, you should expand with a jack screw, RPE design of some sort. Because once it's in mixed dentition, they have a little bit more, they're beginning to have some spicules that might be a little bit harder to open the suture as quickly and easily. But in primary dentition, a quad helix is a very good skeletal expander. And you can change everything for that patient just with expansion. I am not by any means suggesting you don't address the issues in other ways, and we'll get to that in a moment. But please think about the fact that your expansion can get rid of snoring, mouth breathing, bedwetting, ADHD, ADD signs and symptoms of behavioral issues, learning issues, speech issues. Now, having said that, of course, it's very important and best to have a multifactorial treatment plan to address an ENT referral, to look at soft tissues of tonsils, of adenoids, of areas in the actual breathing apparatus so that they can get to breathing through their nose and producing nitric oxide through the nasal mucosa that's not produced in the mouth, which expands the vessels and the air sacs and the alveolar air sacs. Yes, those are very important things. Refer to the ENT. Make sure the ENT has your x-rays if you have them. Make sure they understand your concerns. It's very important to look at frena, especially sublingual, to be sure that that frenum, that tongue, is able to move freely, which has been shown to be part and parcel of all of this. It's very important to look at areas of habit and look at bluegrass appliances, habit appliances to help reduce that. Those are important things. But let me summarize again. The simplest, most important factor here is expansion. And you can expand just short of buccal crossbite, whether you think they need it or not, because they do. Trust me. So don't go into buccal expansion. If you do, don't panic. In a quad helix, take it, after it's there for a little while, it'll fall back a bit. In RPE, you can even turn it back if you need to. But do go just short of buccal crossbite whenever possible. Expand for these kids and change their lives and yours. Dr. Chris, signing off.